Rhode Island is dropping its residency requirements for vaccines. That means you can get a vaccine at any distribution site regardless of where you live.
This change was announced during the governor's weekly COVID-19 briefing today, where state officials also announced they'll be putting up pop-up clinics in high-traffic areas like beaches and the airport. 12 News reporter Anita Buffoni was at today's briefing and joins us now live in studio with what's being done to get more shots in arms and updates to the state's unemployment program. Anita?
Mike and Shannon, as vaccinations for Rhode Islanders moves full steam ahead, the state's tourism season kicks off starting Monday. You no longer have to live in Rhode Island in order to get a shot. The warmer weather brings thousands of tourists to Rhode Island each year. Now, starting Monday, those visitors can get a COVID-19 vaccine in the Ocean State.
Because it's a destination, a vacation destination, and we want to make sure that we keep everybody safe, including our visitors.
Pop-up clinics will be brought to high-traffic areas like beaches and state parks to make this effort as easy as possible. Health leaders say they are seeing a demand for young teens to get the vaccine, and there is a high vaccination rate for adults throughout Rhode Island. But as a percentage of those still have not gotten their shot, the health department pleading with those to reconsider.
The bottom line is that wait-and-see approach for vaccinating does not work. It's not going to protect you, and it's what I want to strongly urge you to change.
As the governor was on the briefing stage, the CDC announced fully vaccinated people can largely ditch the masks indoors, except in crowded settings.
I'm getting the same text you are right now as I'm sitting here, and certainly going to evaluate that. It will be promptly looking at it and relying on our health department to make the right call, but the CDC is a good endorsement.
Now, as for unemployment, McKee says he does not plan on ending the federal $300 benefit as other states have. I'll have more on what he and the DLT had to say coming up at 6 o'clock. I'm Anita Buffoni, 12 News.
Breaking news, a major turning point in the country's battle against the pandemic.
This afternoon, the CDC said people who are fully vaccinated pretty much no longer have to wear masks indoors or outdoors. A short time ago, President Biden says it's another reason for people to get vaccinated if they haven't already.
It's a good day for the country. We aren't done yet. We're still losing too many Americans, because we still have too many unvaccinated people.
President Biden says people have a choice between vaxxed or masked.
The only place the CDC is still recommending vaccinated people wear masks is on public transportation, like planes, trains, buses, and subways.
But it's up to each state to decide when to lift its mask requirements. 12 News reporter Anita Buffoni updates us on where Rhode Island stands. Anita?
Shannon and Mike, it hasn't been made official in Rhode Island just yet. The CDC made this change to mask guidance while Governor Dan McKee was on the briefing stage. We were told just about an hour ago McKee's team is meeting now to review this new change. The CDC may have made the announcement they are easing mask restrictions for fully vaccinated people, but Rhode Island needs to officially update its executive order on masks before it takes effect here. Shortly after the COVID-19 briefing, Governor Dan McKee spoke about the state's plans.
When they came out with the guidance a few weeks back about outside mask wearing, we were very quick. Within 24 hours, we had followed that guidance, so I would expect the same thing to be happening here.
Meanwhile, earlier in the day at the Vets Auditorium, McKee announced you no longer have to live in Rhode Island in order to sign up for a vaccine.
We're happy to see our neighbors from Massachusetts and Connecticut get vaccinated in Rhode Island. Please, visit us.
All part of the strategy to make the vaccine as accessible as possible. The state will soon operate pop-up clinics at state parks, beaches, and the airport. Turning their focus to unemployment, McKee says he does not plan on ending the federal $300 benefit as other states have, but director of the DLT reminded Rhode Islanders they must soon show proof they are searching for work in order to collect UI benefits.
We'll be auditing claims, and we'll do so more than we did in the past, to make sure that people are looking for work. It's time to get people reconnected to the economy.
And in terms of vaccine, there is a demand for young teens to get the vaccine. Health leaders say 300 people 12 to 15 years old signed up within 24 hours of that eligibility opening up earlier this week. I'm Anita Buffoni, 12 News.